Welcome back to another episode of The Feeding Hour. In this episode, Abby and Catherine, me, sit down and discuss the challenges of low milk supply, and we particularly focus on understanding how each breastfeeding journey is unique. We talk about the basics of milk supply, the impact of birth experiences, and the significance of mental preparation, and, of course, having support from lactation consultants. We hope you find this helpful. Thanks so much for joining us in this journey. Alrighty, everyone, welcome back to the Feeding Hour. I'm here with Abby, and today we're here to talk to really all of our quote unquote low supply moms or second time moms that maybe didn't breastfeed and want to breastfeed, or moms in general who might not know anything about supply. So we're talking all about supply today in our episode. So let's
Love it.
we're so
And
excited.
we were really talking about like what would be a helpful message for someone who just it didn't go well the first time, which is more common for it to not go well the first time because you've never had a baby before. You don't really know about birth. You don't really know about feeding. And so let's say you had a traumatic birth or you had a NICU stay or you had low supply or you got this label. Like even I've heard labels of like something with your nipples is wrong. And it's like, no, your nipples are fine. Your boobs are fine. Your milk supply is fine. Milk supply is also variable and changes over time depending on supply and demand. So, like, just because you got a label one time does not mean that you're like doomed for that baby, but especially you're not doomed for the next baby. Like, every pregnancy is different. And we just really want to speak to, like, if you feel kind of upset about how your feeding journey went the first time, and you're like, "Okay, now what do I do? Do I just, like, go full forge and, like, I'm a formula mom and, like, I don't even." I think a lot of people just feel shame or sadness around it, and so then they're like, "I'm not even gonna try the second time."
Yes.
But your milk's still gonna come in. So, like, let's talk about, like, the mental work and just, like, how to prepare better and get better support the second time, and maybe you will have a different experience.
That's it. And I feel like a lot of moms feel so, like you talked about, the shame. And so they get super pro formula. They're like, heck yeah, I'm like on a formula game. And it's like, okay, well, you can't deny the health benefits of breastfeeding. And when you
Yeah.
like just kind of have some hope and kind of just keep moving, and you're like, okay, I I didn't breastfeed for my first baby. Let's go. Let's see what we can
Let's
change
try again.
from a next.
Let's learn more, try again. I mean, because this is the thing, like, I feel like people do that all the time with VBACs. Like, they're like, "Wow, I had a C-section and now I wanna try for a VBAC." And because they know that, like, the recovery might be better, or they know that there's some good
Gut
outcomes
health
for the
for the
baby for
yeah.
going for not having another abdominal surgery, right? And sometimes they might tell you you need it for whatever reason, which is also totally fine. Like, we're not shaming anyone's decision for either of these things. I just and I admire people so much who do, like, switch to formula and find a way to feel good about that decision, because I know a lot of people who are like who feel sad that their breastfeeding journey ended. Like, and some people, this is not even, they're like, I wanted to do 3 months. I did 3 months and now I'm switching to formula and I'm perfectly fine. And that's fine. Like, we're not talking to those people. We're talking to the people who do feel sad about their journey. And they're like, wow, I wanted this and I feel like I didn't have the right support, or it was taken from me, or I couldn't do it, or my body failed me, like, just anything that felt like was out of your control in meeting your feeding goals, you know?
All right, so let's hop into the basics because I think also that contributes to a lot of anti-breastfeeding as well, is women who feel shame around, well, my body didn't support me. So let's get the basics down of supply. So I want to kind of give the factory analogy because this kind of blew my mind. So your supply, it has nothing to do with how much food you're eating. It has nothing to do with your, I mean, like
How
stress
big your
levels,
boobs are,
right? How big your
what
boobs
they look
are,
like.
even nipples. Like we don't the baby I think we talked about this in different episode. The baby doesn't nipple feed, it breastfeed. So if you have
Mhm.
please turn. If you have inverted nipples, there's 3 different, like, classes of inverted nipples, and we could do a whole episode on this, but if you have, like, first of all, class 1 or class 2, you're totally fine, and also your nipples do, uh
Stretch and prolong, like, elongate.
yeah, and exactly, like, stretch out during pregnancies and when the baby is close to the breast. So, like, you might have inverted nipples pre-pregnancy, and then once you have the baby and all your hormones are working correctly, you are good to go and you can breastfeed. Alright, and then, I wanna talk about birth too. I'm kind of going off, but did you have anything to say about, you know
No, I mean, I agree with everything you said, like, y you really there's, like, one thing that can happen that's called, like, insufficient,
glandular?
glandular tissue, and that's, like, the one diagnosis that's like, "Okay, you actually might have primary low milk supply," but other than that, even thyroid issues, even PCOS, even, like, other conditions that are known to affect your hormones and affect milk supply, with the right medication, with the right intervention, you can it's not, like, impossible for you to have a full milk supply. So I think that's such a good message if you are worried about any of those things.
Yes, and note it about stress, like, when we're like, "Oh, I'm stressed, so I couldn't feed," it's like, you think about women who fed their babies during the Holocaust, in concentration camps, or women who are refugees who feed
Mhm.
their babies regularly by breastfeeding, or the story of the woman who breastfed her children as she was dying on a cruise. We'll link it below, but essentially, yeah, she, like, gave so her children survived and she passed away, but because she was able to induce lactation. It's just amazing
That's
what the
so
female body can do. Yes.
Yeah.
So let's talk about prior to birth, how to set yourself up for a good milk supply, and then at birth. So when I think
So
about it, like, and
Mhm.
what I've learned just in getting like my lactation counseling certification, is
Yay.
let's go, is that, like, I I remember I used to hear this of and I was talking to my sister about this last night, that, "Oh, you had a natural birth, like, do you want a cookie?" And it's like, um, no, but you do like, you set yourself up for breastfeeding if you have low intervention. That's not controversial, it's just plain facts and evidence-based.
Yeah. Like, that's what, I relate to that a lot because it's not like anyone's like, "Oh, this sounds so fun to, like, not have an epidural." It's that when you look at the research and you see that, like, oh, these outcomes are just better recovery and better, like, you can feel the baby, so pushing times are shorter, and then, like, the baby is really alert when they're born because they didn't have anything going into their system. The baby's ready to latch on. Like, when you hear about that, like, that's kinda why I wanted an unmedicated birth, was because I wanted the breastfeeding to go well. So I think that's a lot of times on our podcast, we'll hear people when we hear people's stories, they say they tried to do a low intervention birth for that reason.
Yes,
Yeah.
exactly. And it's amazing because you need to have that motivation to go through like a low
The
intervention.
pain. Yeah.
I probably will. And learning about how you, I think we might talk about this in a different episode, but like the baby can see different colors in terms of what's darker and what's lighter. And your areola is darker,
It's
becomes darker around that birth for that reason, so that they can find
Mhm.
their target with the smells. But
So cool.
um, if that like those senses are sort of tampered with, or maybe I should use a different word, but like
No, yeah, like,
intervened.
if there's interventions, then I just think whenever I do a consult, the first thing I ask is, like, how was your birth? And, like, was it a C-section? Even if they had an epidural or IV fluids, that even just changes the weight of the baby when they're born. So then when everyone's doing the math, calculating how much weight the baby is losing, it's a little inflated because they probably had some extra fluid after birth. Um, so I don't know. I just think the more, like, physiologic we can make it, then the
The more
the
logic
less we
breastfeeding will
muddy the
be.
water.
Yeah.
Yeah, the more physiologic and, like, less interventions we'll need for breastfeeding. Now, if you have a separation, I mean, I'm here with, like, I had a lot of separation from my first baby, and we were still able to breastfeed, but we had to do a lot to kind
Yeah.
of mitigate all of the things that happened that made it a less natural process or a less easy process, yeah.
Yeah. So summary, low intervention as possible. Set yourself up for success. Okay.
Mhm. Oh, another thing is before birth, like trying to collect colostrum. I think a lot of people don't even know about that their first time. But if you do that, it can also help induce labor if you're like past 40 weeks and you're trying to. Um, but learning how to hand express and like collect colostrum beforehand, which is I feel like that term sounded so scary to me, but like literally all it is like squeezing your nipple and trying to get milk out. And like you just get little tiny vials of it and doing that can help because you can give it to the baby right after birth, and it also, is good for, like, kind of establishing your milk supply and getting you to start making milk
And
earlier.
if for more information on that, it's the first episode of our first season. We talk
Oh,
about what
we
to know
talked about that.
about birth. And also careful on that, like you can induce labor. So don't do that at like 38 weeks, like 37,
Yeah, yeah, yeah.
don't do that prior to your due date. I mean,
True, 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 true.
yeah, so the factory analogy. So baby is born, right? You it is supply and demand just like a business. So it, you need two hormones, oxytocin and prolactin. And by putting the baby on the breast, the stretching of the nipple and then the like touching, this stimulation of the nipple tells your
Mhm.
body make milk. So your body will not know to make milk unless, and we talked about this in the first episode, there is a demand on the breast saying, hey, make milk.
Yeah, and you need the big drop, you need the big hormonal change that happens after birth, and that is why sometimes retained placenta will cause you to have low milk supply in the beginning because then you don't get that huge shift. Basically, your body knows when the placenta is delivered, that is when your body's like, "Oh, it's time to now feed another way."
Yes. Yeah. There's three
But
different
then you need the
stages of milk.
supply and demand as well. Yeah,
Yes. Yeah. Yeah. Like there's three different stages of making milk. And the delivery of the placenta triggers your body to go into that next stage. And yeah, it's, you love it.
fascinating, honestly.
So interesting and stuff that I never would have known before. So let's get
Mhm.
into like the label of low supply. What are some reasons that a woman might have a low supply? We talked about retained placenta. We talked
Yeah.
about, so our last episode, we talked about efficiency at the breast. And so if the baby is not getting any milk, then demand is going to be low.
So
What else?
then it's already telling your body to make less. Um, other conditions that affect your hormones, could affect things like PCOS, thyroid issues, diabetes, um, anything like that. I would just say it doesn't mean that you're going to have low milk supply. Also, if you had a breast surgery, like a breast reduction or um, even implants or anything, like depending on how they do the surgery, they can damage certain parts, and so then they can cause you to even have like certain parts that do fill up and other parts that don't. So it's you know, this is why if you have any concerns like that, I would work with a lactation consultant to just like see how your supply is doing. Cause whenever I'm doing an eval, that's like the first thing is like, how is the supply going? Then we look at the baby. How is the baby's skill and function? And then hopefully everything is going well
Yes.
both ways. But yeah, those are kind of, but I think a lot of times you get this label of like low supply or my milk's not coming in or my milk's coming in late just because of like having a C-section and it took a little more time, or I had a separation from my baby, or I was really out of it after birth and I didn't know to pump right away. And so sometimes that can persist. And like, because in the first 48 hours, you didn't have a lot of milk removal, that can persist. Or sometimes you start up the pumping and then or the breastfeeding, and then you get your supply back up. So I definitely had like a lower supply for a time, but then I got it to where it was like a normal supply. And then my next baby, I had like an oversupply, and then I kind of got it to more normal. So like supply is not stagnant. Like
Yes.
it so that's why we really wanted to talk to like, yeah, like second time moms. Like if you're like, okay, didn't go well the first time, don't just keep that label of like, I'm a low supplier. Like I've heard moms say that. They're like, yeah, I'm a low supplier, or like I just couldn't breastfeed. I didn't produce enough milk. It's like, okay, well, next time you're going to get pregnant again and your breasts will lay more tissue, and then let you've already given birth before. So your birth will probably be lower stress. And then right after birth, just know what to do.
Literally.
Like breastfeed on demand 8 to 12 times. Get a lactation consultant right away to help you get latched on. Usually a lactation consultant can get you on. Even if they have to use a nipple shield or something, it's usually people will tell me like, "Oh, when you left, then I couldn't get latched again." But like you could ask someone to come every single day for like a week, and then, and then it'll taper off. Like you just need a lot of support in the beginning.
And a good lactation consultant will teach you how to induce a latch. You know what I mean? Like
Yes.
a
Yes.
good latch. And so you won't need somebody else to come in because you'll be like, "No." And
I'm
I
confident
can.
I can do this.
And also, it's really the baby that's latching. Like you're you put that nose to nipple and the baby is with it and like a healthy baby, that baby will open up and latch on. Like it's an instinct to do so.
Yeah, I think you know what I think? That just, like, made me think of, like, moms I've worked with recently. I think that you just have to be like, the baby will do it, but you also have to let them fail. Like, you have to let them, like, be on there, cry, try again, get shallow, unlatch them, relatch them. Like, they will do it, but they might not be perfect at it. And you have to be okay with that, like, that feeling of like, are they getting anything? Are they on? It's kind of hurting. Let's try again. Like, you have to treat it as a learning experience, and don't expect it to be like this, like, sometimes it will be like that. My friend I have a friend who told me, like, both times her kids just, like, boom, latched on. And, granted, I probably don't see those cases a lot because 'cause they're calling me, right? But a lot of times, like, be okay with it being a learning process for the baby, and don't get stressed when they're crying. Like, just take a few deep breaths and, like, squeeze out a little milk, give a little colostrum, like, kind of, like, help them get better at it.
Yeah. And watch for when they're hungry. Like infants, we're looking for because they literally open up their mouth and are like rooting for the nipple. You know what I mean? Like they open up their mouth and you can just like, oh, awesome. Like we talked about last time, the communication starts now and they are communicating with you with their hands. Okay. So to summarize, Abby, what would you like to say to women who perhaps had a low supply in their first pregnancy and
Mhm.
are having another baby?
Yeah, I would just like to say that, like, anything a provider or a lactation consultant or you've told yourself about, like, how your body was working, you know, aside from, like, a medical situation, like, there's there's always room for, like, it to be different this time, and it doesn't have to be the same exact story. Um, Again, like, I just think about myself, and it very easily could have been that, like, my son wasn't able to breastfeed, and if he wasn't, like, I hope that I would have had the courage to just try again the next time, because and a lot of women are, like, they made it a couple of months with their first one, and then they're like, "You know what? I learned. I wanna give this another go," and, like, I think if we change our mindset around it and aren't so, like, like, of course, it can be upsetting, but, like, if you're kinda like, "Okay, this is just a growth opportunity, like, let's just try again and see what my body does," and then like, let's just see like, just be have an open mind, and I think a lot of second-time moms have that perspective of like, "Okay, if I need formula, it's okay." Like, I don't have this shame around it anymore, I don't have this, like, fear, but at the same time, like, let me give it all I've got, and let me see if I can take a role in, like, getting the best supply I can, and, yeah, I just think that's really motivating and it can be different with a different pregnancy, different baby, different kid, different postpartum journey, all those things.
Everything's different, and you're not, just a low supply woman, like, your body isn't broken, even if you have these thyroid issues or PCOS, like, you can it's that's one factor in all of them that might, but, like, the thing is prolactin and oxytocin, they are not it's not estrogen, it's not progesterone, like, they are
Yeah.
independent of your other hormones, so, like,
Yeah.
let's really zoom out here and be like, this is what your body was made to do. You can do it. And you just need support from lactation
Professionals.
providers that, yeah, it perhaps, or maybe you can do it on your own. Give it a go.
Yeah.
Yeah.
Exactly. Exactly. I
Amazing.
love this is a good one. I think hopefully it's, sensitive and to people that do struggle with any of these feelings and also like motivating and just kind of takes the complicated feelings out of it and just like I don't know. Let's get support and work on our mindset with it and try
Let's,
again.
and that's a whole kind of point of the podcast is like, so that women can hear these stories and be like, oh, okay, Brittany, formula fed her first 5 children, and then her 6th one, she was like, "I'm breastfeeding."
Let me
And
try this. Yeah.
yes, she was like, "Bump my mom," because her mom told her she couldn't breastfeed, you know what I mean? And it's just like, bump
Yeah.
everyone who tells you you can't breastfeed. You can, and let's do it.
Yeah. Exactly. Exactly. Love it. Also, like, yeah, we could go on and on about this, but like, you can work full time and still nurse all night if you want to, like, or nurse on the weekends, like, and don't let anyone tell you you can't have time to pump at work. Like, ah, goodness. Well,
And milk is good.
always, yeah, don't tell, like, your baby's not gaining weight and, like, you have to supplement with formula, like, ugh, just get help by some by a lactation consultant, and your milk is fine. Your milk is always good.
Yeah, it's so true. One thing I
Alrighty.
heard, okay, I do, like, don't know that, but my baby's, like, allergic to my milk, and the thing
Oh,
is, there's galactosemia. There's literally one, like 1 in 40,000 to 60,000 babies have galactosemia, where
oh my
the baby
gosh.
is legitimately allergic to your milk. So
Okay, we
it's
should do
not the
that just
2
made me
people that I've heard.
yeah. I just realized I have a patient who, is dealing with allergy issues, and I mean, I've had these patients before, but this one has been the hardest one, and I we should do a podcast on that because that is such an under talked about, under-resourced situation, like, working on, like, cow's milk protein allergy and, like, mom cutting out things from their diet, like, it's a rare like you said, it's not very common, but I think it is something that people deal with and, like, don't know how to deal with, so maybe we can do that one day.
Amazing. And
Amazing.
you bottle fed and formula fed and then switch to breastfeeding, maybe with your 2nd baby, reach out to us. We'd love to have you on and hear your story.
Yes, yes, love that.
All right.
Alright, thanks,
Thanks,
Catherine.
Abby.
Bye.
We're so happy you joined us for this episode of the Feeding Hour. If you are enjoying the podcast, please leave us a review or send it to a friend. It helps these feeding stories go out to the public and to new moms that might feel alone. If you have any feedback for us on how we can improve or would like to share your story, please email us at thefeedinghourpodcast@gmail.com. Also, if this podcast has helped you and you're in a position to give back, you can now support us on Patreon to help keep the Feeding Hour alive. Just $5 a month would really help us to keep it going. The link is in the show notes, and we would so appreciate it. Until next time, happy feeding.